Okay. Good evening, everyone. Welcome to the May 11, 2023 meeting of the CB6 Health and Human Services Committee. My name is LV Barroso and I'm the chair of the committee. This meeting is called to order at 6:31 p.m. Tonight, we are joined by Assistant District Manager Brendan Bird. As a reminder, New York State law now requires all community board members to have their cameras on and their first and last names displayed from the time the meeting is called to order until the time the meeting is adjourned. If your camera is not on and your name not properly displayed, you cannot count towards quorum. Members of the public, you can raise any questions or comments that you have through the Q&A feature of Zoom. If there is time following the committee's discussion, we will field questions from the public. Marty Barrett will take minutes tonight. Thank you so much, Marty. We will now take attendance by roll call. Brendan will conduct the roll call.
Committee members, I will call your name and you will unmute yourselves. When your name is called, please say present. I'll announce if there is quorum. Marty Barrett.
Present.
LV Barroso.
Present.
Jason Fromowitz.
Present.
Sadie Howard.
Present.
Sandra Leftoff. I see Sandra here.
Connecting.
I see Sandra here, so I will count Sandra as present for the record.
I'm here.
Excellent. Raj Nayar.
Present.
Kevin O'Keefe.
Present.
Aisha Siddiqui. I don't see Aisha here, so she is counted as absent for the record. Hannah Singleman.
Present.
And Ronnie White. Ronnie White is also absent, but we have a quorum.
Thank you, Brendan. The agenda for tonight's meeting was distributed ahead of time by the board office and is reflected on the screen before you. If there is no objection, we will adopt the agenda. Members of the committee, if you object to adopting the agenda, you may raise your hand through Zoom. Seeing no objections, the agenda for tonight's meeting is adopted. The minutes from the April 13th meeting was distributed ahead of time by the board office. If there is no objection, we will adopt the minutes as drafted. Members of the committee, if you object to adopting the minutes, you may raise your hand through Zoom. Seeing no objections, the minutes from the April 13th meeting are adopted. They will soon be available on the CB6 website. In order to conduct an efficient meeting, let's observe a few ground rules. No one may speak until granted the floor. The committee members, if you have a question about committee business or wish to make a motion, please raise your hand through Zoom. The chat function should not be used for committee business or questions about agenda topics. All such remarks should be made on the record by raising your hand through Zoom. Chat should only be used to alert us to any technical difficulties you are having or to state in writing information that was already stated aloud on the record during the meeting. When a committee member is given the floor to speak, I will identify you and you can unmute yourself so that you can speak. Committee members are required by the state open meetings law to have their Zoom cameras on and your first and last name displayed during tonight's entire meeting, from call to order to adjournment. If you must step away from your computer briefly, you are required to leave your camera on. Before we start with our agenda, we would like to thank Brendan for all the help he gave us in completing our resolution on the EpiPen. I would like to apologize that I forgot to acknowledge Brandon in our meeting last night.
No worries, no worries. All good.
All right, so our first agenda is about discussion on making automated external defibrillators available at subway stations. So what we can do, we can drop a RESA about having a presence of an external defibrillators at subway station. But the question here is, are we only going to put these defibrillators within our district, or are we doing it for the entire New York City?
When I originally started the idea of having AEDs on emergency vehicles based on a pilot program that was going on in Portland or Seattle. I don't remember which. It was in 1993. And I presented it to the Public Safety Committee at that time, which passed the committee, passed the board, went to the council. And State Senator Roy Goodman got wind of it. He put $10 million into it, and it went through the whole city. The police department was the last ones who picked up on it. They didn't want to deal with the training, even though the devices, and now they're even more self-guided, taught the user where to put the pads and what to do and to stand back, et cetera, et cetera. So in our resolution, we should indicate CB6 since it's CB6, but once it catches on, it could be, it should go throughout the whole city. I sent pictures of kiosks in Manchester, England, that they have in wherever there's a big square, or where many individuals would be passing through. That is an example of what they're using in Europe. Yep, there you go. Thank you, Brendan. The device, when the device is needed, you're first pressing a button to call 911, or in England it's 999. But it goes to, there's a button on the kiosk that goes directly to them, and then they press a button which releases the device for the individual to then apply to whomever.
Yeah.
So it's a very workable thing. I don't know if it's only if we would want it only in subways or in other areas.
Okay. That's very good. Thank you so much, Marty. Jason?
Yeah, Marty, in terms of what you're proposing with I think this is a great idea for like broader public access to defibrillators, for us to adopt something like that. I would propose perhaps that would be a separate resolution from the subway resolution. Okay.
Sure.
And I think that I don't know if it would be needed to have a solution that like required like the contact and release in the subway system, in that we have staffed subway stations with station agents that would be able to potentially have access to them, and control access. So I think this is a great idea. I feel like it might be simpler for implementation on the MTA, given the presence of the booths and the staffing. Does that make sense?
Yeah.
They're getting rid of the booths, though.
Thank you.
Yeah, I did know that. But the staff are still there, and I think the booths are still going to be present. They're just not going to be in the booth.
Yeah, but when we make the RESO, do we also request funding? Because who's gonna fund for this?
No,
No?
Community Board 6 does funding in our budget priorities.
Oh,
I have, on rare occasions, a committee has come up with a funding resolution, which I always vote against, even if I'm for the funding, because invariably every committee could then have resolutions for funding things endlessly,
okay.
and it belies our budget priority function.
Okay. So also, I think in our RESO, we need to specify what specific location in the subway these can be installed. Is it not?
So I did some research into this. If you don't mind me chiming in.
Oh, yeah.
Thanks. So I did some research into this. I did find that Grand Central already has public AED, which I think makes sense. But I was not able to find any other larger program of the MTA installing AEDs. And I was also trying to give some thought to which stations we would want to ask, or if we wanted to ask for it to be all stations that become equipped with AEDs. My thought would be we'd want to prioritize some with a goal of requesting that it expands to the whole system or all stations in our community. The problem I was running into in thinking about this, correct me if I am wrong, but I think there are maybe 2, 3 subway stops that are actually within the confines of CP6, which might be limiting.
Good
Hmm,
point.
I'm not sure about how many. Yeah. Anyway,
'Cause
some,
I think we'd be
okay.
Yeah, I just wanted to know how much one of these devices costs.
$1,000.
How much?
$1,000.
Ranges from 1,200 to
Oh,
2,500.
okay. Thank you.
I'd also like to possibly propose that we expand this to include Narcan, and perhaps it's a separate resolution, but that seems even easier to implement in that Narcan's fairly expensive.
That is a separate, you mean to say having Narcan in some?
Yeah, I would. Yeah, I don't know if that's I don't know if it's a separate. If we want to present them
No,
separately,
that,
but I
that's
also
separate.
Okay.
That is separate.
Good idea.
Brandon?
Yeah, just wanted to clarify in terms of subway stations in our district. So Lexington Avenue, 59th Street, Lexington Avenue, 53rd Street. Parts of Grand Central are in our district.
Yeah.
And then the 1st and 3rd Avenue stations on the L train.
So 1, 2, 3.
So
4,
there are a handful of subway stations in our district, and then there are others that are near our district, like the stations along Park Avenue in the East 20s and East 30s.
I see.
I have a question. I mean, which I assume the defibrillators are mostly for an older population. And the question is, if you're raising about various approaches or various resuscitation or whatever you want to call it, I guess I would like the sort of framework of why we pick one versus another, what the thinking is, what's our priorities, because it seems, I don't get the order of things, right? So Narcan's brought up and so on. So do we want to have a sort of a smorgasbord and then see what that looks like and why we would pick, what our hierarchy would look like?
Yeah, I just want to correct your first sentence. It's not just for older people. Cardiac arrest can happen at any age, at any individual, at any person. So it's not just for the older population.
But wouldn't it be, if you looked at it by age, that you would see it's more likely with older people?
No, nowadays, even young people, they get cardiac arrest.
Okay,
And sports fields and gyms, people regularly have heart attacks.
Yeah,
but across, it would be age constant from 20 to 80? No,
not
Lower.
anymore.
no, I'm
Lower.
saying, are you saying it's the same probability between 20 and 80 for cardiac arrest? I didn't know that.
What we are saying that there is an increased number of younger age group that
Yeah,
now gets cardiac arrest.
okay, but then what about the rest of it about?
We don't
with-
want to, say that it's only for,
Yeah.
we don't, because even our CPR, we say that anybody can get cardiac arrest. So,
Okay,
it's not just for older people.
okay, but the
I would-
second part was about what's our priorities, how are we determining that, so that it's got some, some order to, or the logic of it would be great.
I would propose we order by ridership or youth crowding at each station. That data should be readily available to us. I could look into.
Jason, I missed the beginning of what you're saying. So could you say that again, what the,
Yeah, I would propose we would prioritize based on which stations have the largest ridership and turnstile
Well,
activity.
we can pilot study this defibrillator. We can start in CB6. Who knows?
I was
Oh, well,
actually
I-
raising a different issue about which kinds of devices, not where we
Oh,
put them, but what the
devices,
devices are. who we appealing to.
there are so many types of defibrillator nowadays, and it's
No.
very easy to operate, because once you open up the defibrillator, it gives you a prompt, it gives you instruction on what to do. Anybody can administer.
No, that wasn't the point of it. The point was we talked about the EpiPen. Now we're doing the defibrillator. That's all great, but I just wanted sort of a bit of a game plan of what are, where are the needs, what we see the needs are, and what would be the order of trying to institute these availability of these devices. Because it's not my field. I don't know. Where the medical needs are for these kinds of emergency devices and why we pick one versus another. Are we reaching out to the EpiPen reaching a large population? I assume it is. I don't know about the population defibrillators. I'm just trying to get an idea of the community, the usefulness within the larger community. I assume some of these devices have, more emergencies come up around certain devices and not others. That was what I was trying to understand.
Yeah, we have many projects that we have listed under this committee. And these are just projects that we can write resolution. But it doesn't mean that we are neglecting the other projects that we have on the list. Like the project that you are going to be heading or leading. That's a good project that actually I'm going to ask you in the to explain a little bit about.
No, I was just really asking about the medical devices. That's all.
We seldom write resolution under the Health and Human Services Committee. In fact, this is just the second resolution that we develop under Health and Education. The first one is the cannabis, the legalization, and this is the second one, the EpiPen. So if we write something about this is just the third resolution that we have, drafted under Health and Human Services. So, Kevin?
Yeah, I think if this is great, by the way, Marty, if it saves one life, then it's worth all the money. I think that's how we should look at it. And with that said, I'm willing to move this to a motion of no objection.
Thank you.
You're welcome.
I want to ask anybody volunteers to draft this reso?
I'd be happy to, but only if Marty would certainly be a mentor on that, because he's got the knowledge.
And also Jason.
By the way,
can ask-
I second your motion, by the way.
Yeah, thank you. We should have done that. Right.
Yes, right. And I will.
Okay, thank you. And also Jason, can you also help? Jason, you're mute. Please unmute.
Sorry, thank you. I was going to propose an offer to write a companion resolution on requesting Narcan in stations. So we might be able to pass in parallel.
That might be a different reso, Jason.
Yeah. So that would be, that's my, that's what I'm thinking is if Kevin wants to write one on AEDs, and I can write one on-
That would be under new business, since
Yeah.
it wasn't the posted agenda,
Yes, that's right.
Got it.
but sure. Why not?
Brandon? Brandon,
I made a rookie mistake. I forgot to unmute myself. Just to clarify, so this would be a resolution that would be drafted and presented before a future Health and Human Services Committee meeting, the next one, I assume. I'm just checking because I know with the new bylaws, there's the 3-day.
Yes. That's right. I totally forgot. Usually I do not hold meetings in the summer, like June, July, August.
Yeah,
So the next time that we're meeting is going to be in September.
yeah, and I
So-
also know that this is a device that can save lives. So one thing for the committee to consider is whether this is time sensitive enough to, or pressing enough to waive the 3-day rule in the bylaws. Basically, just for review, the bylaws, except for time sensitive matters, requires 3 days between when the resolution is drafted and when it's presented to committee. But I also know June's full board is next month, and there's a summer hiatus, and then there won't be anything until September. So just laying all the information out there.
Yeah, so let's ask.
I guess since I made the motion, I'm willing to do it as quickly as possible. I don't have a problem with that. Marty?
I retired, so I have plenty of time.
I'm really keen on you now.
3 weeks ago.
I'm so glad, Marty, you are with us. Okay, so yeah, so how do we say that, Brendan?
Committee can still vote on a resolution if anyone for some reason disagrees with not adhere, of waiving the 3-day rule, which the bylaws do give flexibility for that. Someone is free to abstain or oppose on those grounds, but the committee seems to be pretty much on board with this, it seems like.
Okay. So do we have to say something to that effect or not really?
No.
Okay.
No.
All right. So, okay. So moving on. So our second.
Elvie.
I didn't raise my hand. Elvie, when would you like this draft?
It's up to you and Marty.
Okay, thanks.
When you have
Tuesday.
it ready.
Tuesday? Okay.
It's workable.
Also, sorry to interrupt again, but if the committee wants this before June's full board, then the committee needs to vote on the resolution.
So how do we vote? And we're not meeting. This is the last meeting that we have.
Correct. So if the committee wants this before full board in June, then there needs to be a vote on the resolution.
Does it have to be a vote physical? We have to be physically present. Otherwise, you can just do it by one of those, whatever.
It's going to be by roll call.
Well, no, I'm saying, but do we have to be at a meeting? Because the resolution hasn't been written yet. So can we do it by some kind of ballot through email? right? Somebody writes it. No, you can't. You actually have to, okay.
We could vote on the premise that we just discussed, and that the resolution that Kevin will be writing and that I will be concurring on will reflect what we just discussed.
Okay. So do we vote now, Brandon?
If the committee so chooses, yes.
Okay, so Kevin?
Yeah, I'm with Sandra on this, that it'd be nice to touch base after it's written. I know we're doing this in premise, but there are going to be some details in there. I think it's fair that everybody gets a chance to agree to it before full board. If we were in person, we would just huddle before presenting. I'd like to think we can do that virtually if need be.
Brandon, is it possible to email this result to all members so they can make comments?
Committee members can make comments, but there can't be any sort of voting via online. The voting has to happen in the in the presence of an open meeting as opposed to a closed meeting.
Okay, so our
If that
next,
makes any sense.
do we have a full board meeting in May?
The meeting was last night.
Huh?
May's full board meeting was last night.
That was the last meeting?
May's
No,
full board
June.
meeting was last night.
Oh, I'm talking about
In
June
June's is on June 14th.
14. And
Now I
our
will
meeting-
say, if the Health and Human Services Committee chooses to meet in June, I was just looking at the calendar. If the Health and Human Services Committee chooses to meet in June, it would be meeting on Thursday, June 8th, which is enough time for, if the committee instead decides to, draft something and make sure everyone agrees on the draft. The committee, if it wants, can use a June 8th meeting to make sure it agrees on the language, vote on the language, and then present the resolution before full board on June 14th.
Okay, so does everyone agree to meet on June 8th? A short meeting, it doesn't have to be long, just a short meeting to vote for this result.
Sounds like a good idea to me.
It's okay? Okay,
Yeah.
Brendan, so we're gonna have a short meeting on June 8th.
Sounds good.
All right. Okay, so moving on, the updates on Community Board 6 Health Fair. So we have one last chance of getting a space by the help of our contact from NYU. And Brandon and I are waiting for Hannah to let us know. So hopefully we can hear from her tomorrow. If not, we will push this health fair in the fall, either in August or September. Any comments?
We'll have to notify those people who already said that they would be willing to participate, that we're postponing it.
Yeah, I'm actually upset about this because even me in the Department of Health, I already have informed about this June 10. But it's Jesus and Kyle, Jesus and Brendan that does not want to agree on the Epiphany Parish Hall. Brendan, what can you say?
Yeah, I mean, that's not my decision is all I can say on that front. But yeah, I mean, when Hannah Reid reached out about the health fair, that was when I thought, well, does NYU have any spaces in our district? So we'll see.
Yeah. Jason?
Yeah, I propose perhaps it may be too close at this point to be finalizing the location and then continuing to move forward with
Yeah.
a June date. I don't know. My personal opinion would be that we push it to the fall. It's fine.
Okay, so either August or September?
Yeah, either. Probably
Probably
September,
September,
October
Huh?
would make more sense if we're not meeting in the summer months.
All
correct.
right, so September, I'm sorry, yeah, we're not meeting. at
October.
all. So, September is the start of classes, so people are busy in September, so
October probably makes more sense.
in October. Okay, so we'll set that in October. Okay, so we're done with the agenda and I have a report. So I was invited to attend the CB2 meeting last week. And the meeting was attended by CB1, CB2, CB3, 4, 5, and 6. And the purpose of the meeting was to draft a resolution to urge immediate funding of programs that can be implemented on a short timeline to support individuals suffering serious mental illness in mid and lower Manhattan. So, and in that meeting, that was the first time I heard about the Be Heard. Does anybody here know about what is Be Heard? No? Okay, so I developed some slides and I will share with you what is Be Heard. So Brandon, can you please,
and you're also able to share slides, but I can also.
Can we, yeah, can we do that? All right. Okay, so next slide, please. Okay, so what is Be Heard? Be Heard, which means Behavioral Health Emergency Assistance Response Division, or in short, Be Heard, is a new health-centered response to 911 mental health calls. So this started in spring of 2021, beginning with a pilot that is in East Harlem and parts of Central and North Harlem. So 911 call operators will dispatch new Be Heard teams, which consist of the FDNY emergency medical technicians, the EMTs, paramedics team with mental health professionals from the NYC Health and Hospitals as the default first responders to people experiencing a mental health emergency. The new Be Heard teams will use their physical and mental health expertise and experience in crisis response to de-escalate emergency situations and provide immediate care. So these teams will have the expertise to respond to a range of behavioral health problems, such as suicide ideation, substance misuse, and mental illness, including serious mental illness, as well as physical health problems, which can be exacerbated by or masked mental health problems. So in emergency situations involving a weapon or imminent risk of harm to self and others, the NYPD officers and other emergency response resources will respond. Next slide.
Very helpful.
So on Brandon, on the previous slide. Okay. So when and where will Be Heard operate, and how was the pilot area selected? So the Be Heard teams will operate 7 days a week, 16 hours a day in East Harlem and parts of Central and North Harlem. So these areas were identified based on the volunteer of 911 mental health calls coming from 4 of these communities. And this radio zone has among the highest volume of 911 calls in the city, as well as the availability of community-based mental health resources, including a newly opened support and connection center, a comprehensive psychiatric emergency program, which is the CPEP, at Harlem Hospital, outpatient clinics, and other behavioral health providers. Next slide, please. So how will the Be Heard pilot in Northern Manhattan work? What should 911 callers expect? So New Yorkers experiencing or witnessing an emergency should continue to call 911 for themselves, a loved one, a neighbor, or others. When a Be Heard team is dispatched, the team will arrive in a non-transport vehicle and will have the same basic life support equipment as an ambulance. So teams can be identified by their FDNY EMS uniforms and the H&H identification and will arrive in an FDNY/EMS marked vehicle. Callers cannot specifically request a Be Heard team. So based on a description of the circumstances and need, 911 operators and EMS are trained to triage and assign calls to Be Heard based on the call location, dispatch criteria, and availability of Be Heard teams. Next.
Quick question there. Does that assume, can I assume that in the event that the patient decided to be transported and needed to be transported, that they would still need to call an ambulance, or would they transport in the?
Yeah, okay,
Sorry.
so that will be answered when I finish. Jason.
Sorry.
In
Go
there.
ahead.
Okay, next slide, please. So how the Be Heard teams can help. So Be Heard teams will use their physical and mental health expertise and experience in crisis response to de-escalate emergency situations and respond to a range of behavioral health problems, such as suicidal ideation, substance misuse, mental illness, including serious mental illness, and physical health problems, which can be exacerbated by or masked mental health problems. Next slide, please. So will Be Heard teams be deployed in violent situations when a person is suicidal? So Be Heard teams will not be dispatched to 911 mental health calls where violence and or imminent suicide or harm is identified by the 911 operator. Such calls will continue to be handled by NYPD and EMS. Once on the scene, NYPD or EMS can request support from Be Heard teams. Next slide, please. So what are the goals of the Be Heard pilot? The Be Heard is grounded in New York City's commitment to treat mental health emergencies as a health issue, not a public safety problem. Currently, NYPD officers and FDNY EMTs respond to nearly all mental health 911 calls. However, that often is not the most appropriate form of help for those in a mental health emergency and lacks a mental health professional in the response. So Be Heard will help people with emergency mental health needs quickly get appropriate help and health-centered assessments from trained medical and mental health professionals. The Be Heard pilot will likely reduce unnecessary transports to hospitals and will help reduce the number of times police will need to respond to 911 mental health calls. The results of this pilot will inform how the city responds to mental health emergencies in other neighborhoods. Next slide, please. So what kind of expertise do the new Be Heard teams have? The Be Heard teams include 2 EMT, paramedics, and a mental health professional. As trained health professionals, the Be Heard teams can respond to a range of behavioral health problems such as suicidal ideation, substance misuse, mental illness, including serious mental illness, as well as physical health problems, which can be exacerbated by or masked mental health problems. Team members also bring significant experience with mental health crises and are trained jointly to use their physical and mental expertise and experience in crisis response to assess and de-escalate emergency situations. Next slide, please. So what kind of assistance can Be Heard teams provide? Once on the scene, The team will work with the person in need of assistance and, if appropriate, other involved parties. The team will use their experience with crisis response to help de-escalate situations if needed. They will conduct physical and mental health assessments and can provide on-site assistance, including but not limited to connecting the person to their existing medical and/or mental health provider, crisis counseling, or with their consent, connecting them to follow-up services. If the person requires emergency medical services, the Be Heard team will provide emergency medical care and call EMS for an ambulance transport. Next slide. So will the Be Heard teams provide follow-up care? The Be Heard teams will, when needed, refer people to the NYC Health Department for appropriate follow-up services, including the health engagement and assessment teams, in short, HEAT. So HEAT offers time-limited pre- and post-crisis case management services and support to people presenting with behavioral health challenges and/or health concern that is affecting daily functioning. Also, HEAT team consists of a behavioral health professional and a health navigator or peer with lived experience with mental health, substance misuse, homelessness, and/or criminal legal system. HEAT also services are generally in place for up to 90 days, depending on the person's level of engagement and needs. Next slide. So how will police be involved in this pilot? The Be Heard teams will respond to all mental health emergency calls without law enforcement, except where police response is required. The circumstances in which police response is required include situations in subways or involving violence, weapons, imminent harm, criminality, or other circumstances requiring law enforcement assistance. Once a Be Heard team has arrived at a location, they can request backup from the NYPD if it is not safe for the Be Heard team to intervene. In all neighborhoods other than the pilot neighborhoods, the NYPD officers and the FDNY, EMS, EMT will continue to provide coordinated responses to mental health emergencies. When there is no Be Heard teams available in the pilot neighborhoods, an ambulance and police officers will continue to respond. Next slide. So before that. So which city agencies are in charge of the Be Heard pilot? The Be Heard represents a coordinated efforts by the FDNY, EMS, Health and Hospitals, the Department of Health and Mental Hygiene, the NYPD, and the Mayor's Office of Community Mental Health to move towards a more health-centered approach to mental health emergencies. The FDNY Emergency Medical Services and the H&H will manage the Be Heard teams and provide training and ongoing support. And the Mayor's Office of Community Mental Health will provide programmatic oversight for this pilot. Next slide, please. So what's the difference between the Be Heard teams and the call response teams? This is another new one, the call response teams. There are two key differences between the Be Heard teams and the call response teams. When the teams intervene and the kinds of professionals who are on each team. The Be Heard teams respond to 911 mental health emergency calls and include 2 EMTs, paramedics, and a mental health professional from the FDNY, EMS, and the NYC Health and Hospitals. The call response team offer a pre- and post-crisis intervention and do not respond to 911 calls. A collaboration between the NYPD and the Department of Health and the Mental Health Hygiene. Each team includes 2 police officers and a clinician serving community members presenting with mental health or substance use challenges who are at an elevated risk of harm to themselves or others. CRT offers short-term engagement to facilitate connections to care and linkages to support services. CRT officers volunteer for the assignment, and all CRT members have been trained in crisis intervention training and are skilled in working with community members presenting with mental health and substance use challenges. And the last slide, Brandon. And this is the last slide. What's the difference between the BHERD teams and the mobile crisis teams? This is also another new one. The mobile crisis teams respond to referrals from NYC Well for urgent mental health crisis, whereas the BHERD teams provide an emergency response. Both responses involve face-to-face interventions with the identified individual in crisis, as well as their family or other support systems to engage, assess, and de-escalate and connect individuals to the most appropriate services. Most mobile crisis teams include both professional and paraprofessional staff. For example, a master's level clinician with a peer support staff person. The BHERD teams consist of a mental health professional and 2 EMTs and paramedics from 8 a.m. to 8 p.m. 7 days a week. The mobile crisis team arrived within hours to help people who are unable or unwilling to engage in care. These teams consist of mental health clinicians and peers who can provide mental health services, primarily serving both children and adults in their homes. The mobile crisis team also typically make between 1 and 3 contacts with the person in crisis over 1 to 2 weeks, provide crisis intervention, de-escalation assessment, and linkage to ongoing mental health and substance use treatment and support. That's it. Sorry if it was too long. So the question is that, do we support CB2 when it comes to this BHERD? Because this BHERD does not involve us in CB6. So we can also either support the resolution by CB2, or we can write a resolution of support that the BHERD can also be adopted from 59th Street and below. So that's gonna be within our district. Marty?
East Harlem, Central Harlem is 10 and 11, I believe. So is CB2 looking to get the BHERD?
Yes,
Because,
they are for mid and lower Manhattan. So that includes us also.
Well, if we would want it for us, then sure. But
Yeah.
to write a resolution to have it here. But if the pilot has the pilot program in Harlem, which again is CB 10, 11, and 12. Yeah, they're across the top there. Has it been successful? Has it,
I do not have any information about that, because this is the first time I heard about this BHERD. That's why I said I want to share it with members. Yeah. And Jason? Jason?
Sorry. I think this program is really important and a very good idea. And I'm very supportive of and happy to see the city moving forward with it. One question I had, the post in the teams that follow up for the 90 days, I forgot, those were separate from BHERD. are those services provided at no cost, or are those
Yeah,
dependent on insurance coverage?
it's no cost.
Okay, cool. Interesting. That's great.
Sandra?
Yeah, there was a lot of information in a short
It is
time,
a
so it was
lot.
kind of hard to process a lot of it. So the first thing would be, before I would want to act on something, I'd like to at least see a real statement of the program written out. I assume that if there was a pilot, there has to be a pilot, a document on that.
Yeah.
Which would be great to read. I have a lot of questions. Certain things I can't distinguish, like when do you decide this is an emergency, but it's not, it's what the emergencies look like that these Be Heard teams would be developed or working with, as opposed to, the police get involved. What's,
Well, the
dangerous stuff or-
911 operators will triage. So
Right,
that
but I
will
didn't
determine
understand
it.
what the there was no examples of behaviors which might fall in one category versus another. So if I try to imagine, just the two, the Be Heard versus the 911, what's existing now, I couldn't figure out. It would be great to have some examples so we could understand how, what's going in one place versus another, when the police are called, when they're not, it's not clear, that's all. And I would like more information
Yeah.
on that
Maybe-
kind of stuff, but also to see what the pilot looks like before taking a stand on anything actually on
Yeah,
this.
but
They're potentially really good, but
Yeah.
yeah,
They said it's behavioral health problems such as specified suicide ideation, substance misuse, mental illness, any other physical health problems that can be exacerbated by mental health problems. So
right,
it's
but
not-
I
it's not
got
us.
that. Right.
It's
What?
the 911 operator that will determine if they need to refer that to the Be Heard or to NYPD.
Okay, well, then you'd be left with what's the training of the 911 operator in making that
Oh
distinction?
yeah, they're trained. It was specified that they were trained to triage that.
Okay.
That was stated in what I
Okay,
gave you.
so all that would be in that pilot study, I assume, so we could get some idea of, the details of it, which would be great
Yeah.
to take a look at. It sounds, potentially a great program. It would be nice to know what how that works, how the important thing for me would be, how do they decide A versus B? Who's called in, what are they looking for in the behaviors, and so on. That would be very useful.
Yeah.
So mental
I-
illness, yeah,
I can provide a little bit of context from my previous EMS background on how that works. So I don't know about how they set it up for this program, but generally the way 911 calls, medical 911 calls are handled are basically the 911 operator has a script of questions that they ask, and they, depending on the answers to each question, they're able to make an assignment on the proper care that's required for that emergency. So today that's used, or previously that's used for determining whether or not you're in need of EMT for basic life support or a paramedic for advanced life support, as well as potentially like how urgently, well, not potentially, as well as how urgent the priority for the call is, and like in terms of like scaling how quickly you might get an ambulance over somebody else. So my assumption is that they've integrated mental health questions into that question, and the system based on the answers to like a specified set of questions
Yeah.
or how they're determining which team to defend.
okay.
Yeah, this can be a project probably in the fall, so we can
Yeah.
get more information about it.
That would be great. And if we
All
could
right,
get
so-
some written stuff on it, would be great.
Yeah,
And Jason, I would love to know how they, what they actually do on the 911 operators. That training becomes so significant in that. And also one thing, Jason, I'm having trouble understanding you on, maybe other people not, but it's just you're coming up a little garbled. So I really want to hear what you're saying, and I'm getting
outside.
frustrated.
probably because he's outside.
I know, but
Yeah.
but he's saying interesting things and I'm missing some of it. So just so you know.
Yeah, Marty.
I'm sorry, I'll
Yeah.
stay inside for the next one.
Yeah, Marty, you have Marty.
Well, the whole idea of it is wonderful. I have to say something personal. A couple of hours. At the end of this month, I'm supposed to go I'm going to New Orleans for a bat mitzvah, and a couple of hours ago, I heard that the mother committed suicide.
Oh, my.
Yeah, it's absolutely horrendous. She's had problems for many, many years, but it's really shaking for all of us. It's actually the first person I've known who has committed suicide, and it's horrendous.
Yeah.
And her daughter, the couple's divorced. The father was in business in Minneapolis. I guess he's home. He's home by now. He flew back, but it's absolutely horrendous. And maybe if they had something like this in New Orleans, it might have prevented it.
Yeah. So we have a lot of projects coming up in the fall, but before we end up, Sandra, you want to say something about our under the old business about
Sure.
yeah.
The neighbor to neighbor. I think I talked a little about it at the general meeting, I guess last month. And this, so I'll just in a sense re-say it, and hopefully some of you on the committee will be interested in working on this with me. It started for me during the pandemic, and we have when it happened, there was a number of old people in the building and older people in the building. And everybody, of course, got locked down, and nobody knew what was going on with anybody really. And the soup had kept up, the doorman building. But it was very troubling. I know at one point, one of the synagogues around here reached out to me and asked if I would keep an ongoing contact with some of the people that they were concerned about. And I certainly was concerned in general that seniors were, and a number of who were single in the building. We didn't know what was going on. There wasn't the outreach that one would hope for. And so I began to think that it would really, I called it neighbor to neighbor, but the idea being to hook up younger people in the building or with seniors, so that there's an ongoing relationship between individuals in the building on that basis. Drisha, which is a larger program on the Upper West Side, which works with seniors, has versions of that, but there isn't any systematic in local communities to do that. And it really certainly seemed during the pandemic, and I would go certainly beyond that, of great significance. I'll give you another example in my building, which used to be totally rent stabilized. We knew everybody very well. Somebody got sick, everybody knew it, and we cooked meals. We checked on them. We wanted to know, we were concerned. The building changed, it became condos and rent stabilized. And there was a real split, and that kind of outreach stopped, but it was in many ways of great significance. And so what I have proposed is having a pilot program in our district with certain, starting off with a select number of buildings to develop outreach between seniors and a neighbor who will have ongoing contact between them, not a one-shot deal, but where there's a relationship that can develop. I've so far reached out to Senator Kruger's office, and they're just wonderful. Every time I reach out to them, I think, God, they are so much there. And the person I spoke to had great suggestions, including Senator Kruger getting involved with various outreach approaches and organizations that would be interested in working with us. And so this would really be a pilot just to see what the issues are and getting it started and how it can evolve. I'm also going to work with Carlina Rivera's office on it. And so it's right at the ground where it takes both the work of figuring out what would be a way of approaching it, and then running it in some of the buildings in our district, I think of Stuytown as one, Peter Cooper Stuytown, because it's there and we have a person on the board who's from there. But other buildings, other buildings as well as a small sample. So again, I'm hoping that some of you will be interested and please get in touch with me. My email's on the CB website, and we can go forward with it. And if you have any questions, let me know.
Yeah, Sandra,
Yes.
I have a question. Did you already come up with a name of that program? So
I call it neighbor to neighbor. That's my name for it.
Huh?
Neighbor to neighbor.
Okay, I suggest instead of neighbor to neighbor, would you wanna consider Neighbors Connect?
Oh, that's nice. Sure. That's great. Sure. Neighbors Connect. I like that. Sure. Thank you. Okay.
Yeah, so at least we know when we're talking about that program, we know that,
Yeah.
that's about the Neighbors
Yeah.
Connect.
That's great.
Yeah, Hannah?
I love the idea and definitely I'll email you and I would love to help, but just a quick note, I've been chatting with the mayor's office for Breaking Bread, Building Bonds, that initiative they're doing. And for work, I do a lot of research into like questions and how to have better conversations and how to create the space for curiosity. So there's probably some really cool overlap with when it
Yeah.
comes time to like building materials, like questions that you can ask your neighbors to spark conversation. So just throwing that into the ring if it sparks something,
Great.
but would love to help.
Oh,
That's
I'm
good.
signing you up immediately. You're not
Yeah,
getting off the
that's very
screen.
good. You can probably, yeah.
I'm in.
work
I'm
with-
in.
with Sandra.
All right. You want to, how do we do this? Like, how do you send me your email so we can keep it? Should we do it through the chat? I'm not good at,
Uh,
or
So
yes, LB, how would
I
we?
think we.
But I
did-
love what you're saying, and that is, I didn't know the mayor's office was doing some of this stuff, but those are, you're right, those, how do you ask the questions? How do you start engaging? Absolutely. It needs to be addressed.
Yeah, just make sure when you connect to each other, just make sure you CC Brendan, because we always wanted the office to be in connect with whatever we're doing. So Brandon should always be CC'd.
Sure.
Any other, oh,
For the minutes, is Jason going to be writing up a resolution on Narcan?
I would like to.
yeah,
I will.
you can start, Jason. Kevin has a question.
I believe Sadie was before me.
Oh, Sadie.
Yeah, I was just wondering, I think it's a really good idea. Over the pandemic, my family became really close with our neighbors, so I definitely see the merit in it. And I was just wondering, would there be any sort of application process or like vetting to make sure that like people are like their personalities are compatible with each other, or would it just be like completely random?
That's a great question. And so, the model what you're suggesting, interesting is what Drisha does. They're much more, they've been at this a long time. And so when they're very conscious of how they match up. My gut level response is, as a pilot, I think we would likely be winging it first time around just to understand what the issues are in setting it up, right? And how do we reach out in both sides? But that's a great issue as we get it going a bit. So Sadie, if you want to pursue that further, please send me an email and I will rope you into this if I can. But I love it. But that's exactly the way people got reconnected or didn't get connected during the pandemic, and what that meant is, I think, has been such an important issue, both in terms of it really pushed certain people to the side, and yet for others, it reconstructed community in some great ways. So that's what I would like to play on. Anyhow.
I think these should be well organized. It should be well structured, wherein we can identify who are the neighbors that's connecting to the next neighbor. So at least they should have some responsibility. Otherwise, something can happen and they, so we will, this is gonna be a lot of planning.
A lot of money? I
lot
put a lot
of
of work. I'll
money.
do them.
Lots of planning. It's not just one quick thing that you connect with neighbors. No, it has to be well structured. That's how I would see it.
Well, okay, the pilot will be whatever the pilot is, and we'll go from there. If it starts looking good, it'll be great, right? Right now, I think what's great, it's an idea, and, I love it. Yes, I always love money. And these are all issues that are quite relevant. How do you keep it going? What are the issues that you really
Yeah.
want to address, and so on? All very relevant. So great.
Kevin?
Quickly, first count me in. One thing that I found that's really helpful, I love people getting outside and not necessarily having to meet inside in closed areas.
Yeah.
And I know there might be some health restrictions, but to me, and I've already done this on a small basis, going for walks with people that are older, in my case, and showing them the neighborhood, because it's not just getting the exercise, you're talking during that time, and it's amazing what people don't know about what's just down the street. And like going to the river and seeing the what's happening, obviously, with the seawalls, flood walls going up. A lot of people don't see it. I live in Stuytown. So I would love to have a walk element to it if you need someone to help put that together.
Good. I'm putting you down on the list too. Great. Yes. I do also add the other one, which is you're the teacher, but older people who've been in the neighborhood a long time have such stories to tell, all right, as well, right? So it's a two-way street. So everybody's got something, but it's a great way of doing it. Yes. Thank you. Okay.
Oh, thank you. Thank you.
Okay, so any other new business? So the Narcan, we're gonna put that in under new business, isn't it, Brandon? The writing of the restaurant on Narcan, that's gonna be under new business.
Yep.
Yeah, okay. So any issues, any other business? Nothing else? Okay, so thank you so much. Oh, Marty has one last question. Marty?
Move to adjourn.
Oh, yes. Thank you so much, everyone, and meeting